we all are aware that our current system is defiled by profit incentives and corporate interests, and we know that there's some mighty large obstacles we're going to have to overcome if we want one that's based around the needs of patients, and if we want a universal single payer public good health care system. I think it's that in that spirit that I'm really pleased that we have an opportunity to hear from Tadepalli. Dr. Tadepalli is a geriatrician based in Durham, North Carolina, and she's a longtime member of PNHP, Physicians for a National Health Program. She saw the need for a multi-issue political home for healthcare workers on the left, and she and fellow PNHP member Dr. Scott Goldberg co-founded Doctors for Bernie in November 2019. Later, Dr. Tadepalli, in the midst of the coronavirus pandemic, the group joined with the Democratic Socialists of America Health Workers Collective, whose mission is to organize workers in healthcare, regardless of discipline, around the struggle for a health system that values workers and patients over profit. So let's all give a warm welcome to Dr. Tadepalli.
Thanks so much, Will. Thank you all for having me here today. I'm a geriatric and palliative medicine physician, so I care for adults with serious illness and adults with disabilities who need long-term care. And in my experience trying to serve basic human needs in a system driven by profit, I've seen firsthand how this system kicks people when they're down. I probably don't have to tell you all how normal it is, unfortunately, for our healthcare system to impoverish people in order to get the care that they need. And I wish I didn't have to tell you how normal it is for me to see people in the hospital and the ICU because they can't afford their medications or the copays and deductibles for services that they need to take care of themselves. Because our system ties health insurance to employment, millions of workers have lost their healthcare in the middle of a pandemic. Even before this crisis, nearly 1 in 3 Americans were uninsured or underinsured, with lousy insurance leaving them struggling to pay for care when they needed it. Now the situation is much worse. Communities hit hardest by the coronavirus largely do not have health insurance coverage at all. So I'm using this word underinsured, which you may be familiar with, but just in case, what does that mean? It means lousy insurance that doesn't cover us fully. So half of us in this country get our insurance from our employer through the private insurance companies. And most of that insurance is lousy. Providers like me are starting to use the term financial toxicity, referring to the impossible choices our patients face if they come down with a serious illness, a choice between prioritizing their treatment and going bankrupt, or dying prematurely from inability to afford treatment or stabilizing personal care or long-term care services. Let's talk about cost for a second. $3.9 trillion is a figure that's quoted. It's double what other wealthy nations pay for a system that leaves many people broke or prematurely dead. Why does this lousy system cost so much? If we break down cost into services rendered times prices, so services rendered times prices, that means, and I tell you that the studies show that we don't use any more services than other wealthy nations, that means that the problem is the prices. The prices are too high. And why are the prices high? Well, it's because of the racket between hospitals who set the prices and private insurance companies who agree to those prices because they're paying for them with your paycheck through your employer. As costs have risen in the past 20 years, workers' contributions through payroll deduction have increased by more than double, by 242%. And this is actually a primary reason for wage stagnation in this country. Employers are transferring the increasing cost of healthcare to their workers, and this trend will only continue. Working people and the poor pay disproportionately more into our health system than the rich do. So the way we're doing this is like a regressive tax. Our health system is extracting wealth from workers to pay for executive salaries and administrative waste and a bloated corporate bureaucracy. In a way, our health system is reproducing inequality by facilitating an upward redistribution of wealth. Insurance and drug companies are making record profits by taking bigger and bigger cuts out of our paychecks. The point is, we are already paying for Medicare for all, we're just not getting it. 2020 has made clear the enormous value of the labor of essential workers who keep our communities going. We know that the labor of health workers who have cared for our families this year has enormous value. Ultimately, C-suites of hospitals are extracting the true value of that care worker labor in the form of their handsome salaries and excess revenue that gets put into a trust so that the hospital can acquire more hospitals, clinics, and buildings and eventually become a monopoly. Meanwhile, those hospitals have been exploiting their workers' time and energy to the edge. And some workers have paid the ultimate price of their life, dying from COVID or from chronic illnesses from toxic stress of that work environment. When one person is assigned too many patients, we do our best, but we're only human. And there is a breaking point where patient care suffers. Families don't get the communication and education that they need. I want to shout out to the nurses at St. Vincent's Hospital in Massachusetts, a hospital owned by Tenet Healthcare, which is a large for-profit hospital corporation, who've been on strike since March 8th, with a central demand for safe staffing ratios to keep their patients safe. The American Hospital Association is one of the main players in the Affordable Coverage Coalition, or the Coalition to Stop Medicare for All. Why do you think hospitals are involved? Because Medicare for All would eliminate the racket that allows hospitals to set such high prices. Increasingly, hospitals are being acquired by private equity, which means those hospitals are ultimately accountable to shareholders on the stock market. So make no mistake, Medicare for All is an enormous threat to capital and to the bosses of healthcare industry. The counterpoint to those bosses are the workers whose labor their profits depend on. Winning Medicare for All will require a powerful labor movement that can pose a credible threat to collectively withhold labor in key sectors, forcing the C-level executives of healthcare industry to concede. In this vein, I have joined the Democratic Socialists of America's Health Workers Collective, a sectoral organizing network supporting early worker self-organization on the job. Because a powerful labor movement will be essential to winning transformative reforms like Medicare for All, the Democratic Socialists of America's highest priority right now is our national campaign to pass the PRO Act, the Protect the Right to Organize Act. The PRO Act will transform workers' rights by dismantling decades of crushing anti-union laws that are a legacy of Jim Crow, laws that allow employers to intimidate and fire Black, brown, and white workers trying to organize together for their collective safety. The PRO Act will make it easier to unionize and will strengthen collective bargaining rights, granting workers more structural power, health, and safety on the job. In the past month, our campaign has made over 500,000 calls to connect constituents in key states directly to their senators, inundating those senators' offices with the message to pass the PRO Act. And it's working. We've actually already flipped 2 of our 5 target senators to co-sponsor the PRO Act. Senator Angus King in Maine, and just last week we flipped Joe Manchin in West Virginia. After this unprecedented year, we need to pay workers back with both Medicare for All and with fast-tracked unions to protect their health and safety on the job. Are we going to let the bosses organize our society around racist abandonment, policing, ecological extraction, and working us sometimes to death? Or are you and I and everyone on this call going to organize it around solidarity and care for each other, around safe jobs and saving lives? Nothing will change without you taking collective action in organization. So I ask you, as people serious about winning Medicare for All, to struggle with the labor movement, to support the labor movement and the campaign to pass the PRO Act. You can volunteer to phone bank constituents in the remaining target states of Virginia and Arizona um, I'll drop the link in the chat, but it's bit.ly/ProAct phone bank, or you can donate at another link I'll drop in the chat. And if you're a health worker, you can keep this conversation by joining DSA's Health Workers Collective. I'll drop all of the links in the chat. Thank you so much for having me, and I'm happy to answer questions whenever the Q&A is.
Thank you, Uma. I think that we will have a little bit of time for question and answer questions right now. So I think, Jonathan Michaels, would you like to start us off with some questions? And then we can open it up to anyone on the floor if you'd like to have some questions as well.
Yeah, absolutely. And I should say, full disclosure, I'm an interim steering committee on the DSA Health Workers Collective as well. But Dr. Tadepalli, I was interested in kind of hearing more about your personal journey towards coming to this conclusion that we really need to put workers at the forefront of the movement if we hope to make a credible challenge to the profit-driven healthcare system. When did that belief kind of come to you? And I know that you've done a lot of reading over the last several years, but maybe this is something you've always thought, but you just didn't see an organization that was multi-issue, specifically for healthcare workers on the left. And then now was the right time to start it. But I'm just interested in hearing your personal story coming to this cause.
Yeah, well, I learned about Medicare-for-All when I was in medical school, and at the time, it seemed like such a no-brainer intellectually. And the way it was framed to me was that the reason why it's not happening is because people just think it's politically infeasible. It wasn't even part of the Overton window, really, of discourse at that time. That was when healthcare reform was being framed around, the Affordable Care Act and expansion of private insurance. But later on, when, after Bernie Sanders' campaign in 2016, that started to actually open up people's imaginations of what was possible, and Medicare-for-All being one of them, I got re-energized in the movement, and just in my reading, learned a lot about just how extractive our healthcare system is, and the basically the position that workers are in basically in terms of the power balance that ultimately is occurring in our healthcare system. So what I mean by that is that when I started to learn about how a few people have a ton to lose by shifting to Medicare-for-All, like that this isn't just about convincing people about how this makes sense. This is just what makes sense. Like, it's literally, our system is not sustainable the way that it is right now. That's not enough. That, like, unfortunately, this really is sort of a battle over power. It made me think more about historically what did it take to win universal reforms, and it made me look at sort of the New Deal era and what was happening in sort of the kind of social movement ecology at that time to allow for Social Security to actually happen. And there is a lot, I'm not a historian, but, just in my study of this, general strikes were a really big part of demanding concessions from essentially the bosses, the ruling class. And one of those concessions was Social Security and the New Deal. And ultimately, I think, given how much of a threat to capital Medicare-for-All poses, it's going to require ultimately the power of workers, which comes down to sort of the value of our labor and the fact that if we take action in unison and synchronized and withhold our labor, nothing will work, right? Like that will bring the ruling class to its knees and force them to give us things that we need. So that's sort of where that's how I landed at sort of that at labor as being really an essential component of the milieu that will be required to win Medicare for all. And I mean, as we're seeing with Biden coming in and sort of having much more impressive domestic offerings than maybe we would have anticipated given his prior record, I don't think that's in, I don't, I mean, I think that's in no small part related to the amount of activism and organizing that's happened in the last 3 or 4 years, right? Is that we've created the conditions for him to kind of be like an FDR type of person. Not quite, but yeah, it's no coincidence. I hope that answers your question.
Absolutely. Thank you.
Thank you, Uma. There's a few questions in the chat around how you chose the senators that you're targeting. And a related question that you maybe can answer at the same time is if there's Republicans in certain states targeted too, and how you can imagine a win in the Senate without getting rid of the filibuster.
Yeah. You know, I'm not like a political wizard and by any means, by any stretch of the imagination. And I'm not really on the inner circle of the PRO-ACT campaign at DSA, but the reason, basically, DSA is working in coalition with the unions, like a national Pass the PRO-ACT campaign that's being driven by the International Union of Painters and Allied Trades, or IUPAT. And kind of together, the choice of targets was initially was focused on the corporate Democrats who hadn't signed on yet. The majority of Democrats in the Senate had already signed on, and there were only a handful who hadn't. And so we wanted to make sure that ultimately this is also like a educational campaign, highlighting and making it painful for these senators to force them to show us which side they're on, right? The side of corporations or the workers. And, you know, that was the reason for just at least getting the Democrats first. But there is talk, I think now, of beginning to target some Republican senators. Which ones, I'm not sure. I will say that in the House, there were some Republican House representatives that did sign on to the PRO-ACT bill. So, you know, stay tuned. We'll see. But we're starting with those target senators first.